Hello, hi. I'm Sabina Dizdarevic, your current BNMS President. I'm really delighted to have today Dr. John Frank as our guest, and I would like to introduce you to him. Dr. John Frank was our past president of BNMS from 2006 to 2008. He trained in radiology in Barts Hospital and in nuclear medicine, Middlesex Hospital, now UCLH, and obtained MSc degree from UCL and FRCR in the same year in 1978. Dr. Frank was appointed consultant in nuclear medicine and radiology in Southampton, but after 3 years he moved back to London to Whipps Cross Hospital as a radiologist developing and running nuclear medicine, where he stayed for 18 years before moving to the Charing Cross and Hammersmith Hospital to run nuclear medicine department full-time until 2008. John became a member of the BNMS whilst in Southampton. While he was working at Whipps Cross, John became a council member. After a while, he took over from Alan Perkins as treasurer for several years. In 2005, John was selected as a president-elect and then president from 2006 to 2008, following Dr. Andrew Hilson. John has retired from clinical practice in 2008 after 37 years of service. Hi, John. Lovely to see you today.
Hi there, Sabina. Thank you.
Thank you for attending our video webinar. And it would be really lovely to share your experience in nuclear medicine and your journey. So could you tell us what motivated you to choose nuclear medicine as your specialty, please?
Well, it's quite interesting because, of course, in the years ago, hundreds of years ago, when I started doing radiology, of course, it was made up of chunks, and one of the 6-month chunks was nuclear medicine. And for that, we went to what was then the Middlesex with Keith Britton. And at the time, Peter Earle was one of the senior registrars. I must say, I found it very, very interesting. And Keith was a very great enthusiast, as you well know, and made it seem so very, very relevant. And so I went back then after the 6 months to Barts and carried on doing nuclear medicine at Barts. At the time, it was a very small and simple department run by physicists. And then, to everybody's joy, Keith moved to Barts and took it over, and it became much more dynamic. And it was because of this that I decided to do nuclear medicine as well as radiology. And as part of that, of course, went to all the courses and got my MSc, which was great fun. And that was really what pushed me, as it were, into nuclear medicine. I must say I disagreed a bit with Keith on that, pardon me, because I felt it was sort of integrated with radiology, but he had a very strong view that it should be quite separate. Nevertheless, we didn't fall out over this, and so I then went from, after I'd finished my radiology training, I then went to Southampton. Joe Joseph had been there and he left, and I took over his post with Duncan Ackery. Now, Duncan was a real character, and I was there for 3 years or so. That was great fun. But then, as you say, I moved back to Whipps. This was for family reasons, really, and was able to turn Whipps from well, it was an enormously busy DGH with a huge radiology input, but it did have a small nuclear medicine room with an old rectilinear scanner, which I changed initially into 1 and then into 2 gamma cameras. And that developed and became a very busy department as well. Also, I did therapy for benign thyroid disease, and it was very nice. But then I got approached to go to the Charing Cross and the Hammersmith, and that was how I ended up there, and was there for 8 years or so till I retired. I retired early a little bit for family reasons, but it was a most wonderful time there. And while I was there, as you said, I set up various courses, one of which is still running, which was based on radiology, nuclear medicine for radiologists. And what was so very nice about that was I got a lot of interesting people in nuclear medicine to come and talk on this course, and a lot of radiologists who went to it actually then went into nuclear medicine either full-time or part-time, and I thought that was a very good thing.
Yeah, it is amazing, truly, because nowadays with multimodality imaging, we know that our training actually changed, and we have radiology incorporated into the training to become nuclear medicine physician, because it was inevitable, really, step because of the development of technology and virtually like a fusion of functional imaging with anatomical imaging and knowledge that is absolutely needed behind that. So it's interesting that I also started my UK nuclear medicine journey in Middlesex with Peter L, with Professor L at that time, who was running the department, which was absolutely amazing experience. That was certainly one of the best departments in the world, and it still is, with fantastic leaders always, and with inspiring people. So I can imagine how, as a young doctor, as when I came there, I just felt almost in a spaceship, because that was how amazing it was. So how you were inspired to move towards nuclear medicine as well. And also it was very, I think, visionary, because we know that a lot of function changes predate anatomical changes, and we know that the future is in really this multimodality, multifunctional, multitrace imaging. And thank you for this, John, for sharing your experience through this journey from young doctor through different hospitals, really. And then how did you then get involved with the BNMS? As I mentioned, it was during the Southampton. Which role did you like really most, or maybe all of them?
Well, I liked all the bits of nuclear medicine, and the Southampton department was a very good, very busy, big one, with very sort of multidisciplinary. The physicists were very active in all this, of course, as well, and the BNMS had started up, and I went to various meetings, and I thought this was a thing to go for, and so that was when I joined it. I managed to fish out my sort of certificate of joining, but it didn't have a date on it, I'm afraid. It was just signed by Mike Maisie, and I think Reg Dukes was the secretary at the time, and I've got that.
That's lovely. Yeah.
I don't think I've got it to hand, but never mind. And it was because of I felt it was so important to be part of a nuclear medicine society. I mean, of course, I was a member and then a fellow of the College of Radiologists, but that was rather different in those days. And so that's how I got involved in the BNMS.
Excellent. And what inspired you to take on the role of BNMS president then?
Well, having been on the council for a while, and then, as you say, taking over from Alan as treasurer, I was asked by Andrew Hilson whether I would like to be considered to be put forward for president. And so in a sort of fit of weakness, I said yes. And so it was. And that's how I became president. And I tried my best and interrelated with particularly the College of Physicians and also radiologists to get as you say, change the structure of the specialty to sort of more integrate it with overall imaging, both anatomical and functional.
Yeah. So, and I mean, now we also like having a clearly major development in molecular radiotherapy, targeted radionuclide therapies, and now we are sort of integrating again back more to clinical world, and it's almost as a like a really nice circle coming back to rounded physician and radiologist, imager, but also someone with really huge clinical knowledge. So there's so much in nuclear medicine nowadays that we can choose from that is truly amazing specialty. So, but looking back during your presidency, what was the main development during that time?
Well, one of the things I was very keen on and got going were the student prizes, and to try and integrate medical students, and not just medical, but physics students as well, into the BNMS so that they could see that there was a future for them in nuclear medicine, in all sorts of imaging and molecular therapy. And I thought that was something which I was actually rather proud of. And then the other thing, as I mentioned, was the course that I set up. And that was very successful, and I'm pleased to see that it continues to be very successful, because I spoke to Amy about the last one, and she said, "Oh, do come." So I sort of crept in the back of the room and sat there. It was lovely to see so many people keen on learning all about it and seeing how it integrated with their radiology.
Yes, yeah, I think it's amazing. You were really always very, very active in training new generations, not just nationally, then internationally. And I'm aware of the fellowship that you started with Professor Adil Al-Nahas, which was for international trainees. And we have a mutual friend, Marina Hodolic, who actually undertaken that fellowship, and she's always like talking about you with the greatest respect and the genuine admiration, truly. And I think it's amazing how many people in the world you trained.
Well, yes, it was, as you say, Adil and I thought about this and set it up. We thought it would be a good thing because we had a big amount of money available in the department, and thought we ought to do something with it. And that was how we set it up. And it started, initially we asked a couple of people for about 3 months, but then because they had commitments back in their base hospitals, it was largely for a month, 6 weeks. And they came, and we had 1 or 2 at a time. And I think overall, I don't know, must have been over 20, 25 people came. They all seemed to enjoy it. And they all learned a lot. We had people from all over the world, from Europe, from what was then still Yugoslavia, from Australia. People just came, and it sort of spread. Its value, as it were, spread by word of mouth. We didn't advertise it as such, and I left a sort of day-to-day running to Adil, and he kept coming to me and saying, "Look, I've got more emails about this. What should we do? We haven't got money," and so on. But we managed, I think. And my own feeling is that he and I enjoyed it enormously, and did all kinds of things to teach. And it was a very successful thing, I think.
Yeah, I think just building up a workforce for the future is something that we really all should be doing. And thank you for this. I mean, starting from the students to junior doctors, trainee registrars, nationally and internationally, is such a big achievement. It's something that we should all really inspire to, even if we don't have a funding, to try to look for them would be lovely to provide. And I think it's good that we have a still International Atomic Energy Agency as well, funding people to come to different departments, and something that maybe we need to look at the BNMS as well. We do have a fellowships for the travel fellowships for different categories. So I think it's very good to really always remember that the future depends on the young generations. Thank you for this, John. So I just wanted to see, what advice would you offer to this next generation of professionals entering the field today?
That's interesting that you ask. I feel that there has to be, as you mentioned earlier, much greater integration with radiological imaging, because the changes that I have seen from things like lung scans, which now are hardly done, PET CT, PET MR are now developing. And for that, you need a very good grounding in cross-sectional imaging. And so I think that you need to have a strong integrated teaching with radiology. And I know that the nuclear medicine fraternity does this. And in fact, the College of Radiologists are less iffy about things than they used to be. And so that's the key thing, that there is this integration of knowledge of imaging, knowledge of structure, and knowledge of function. And that's, I think, the key thing. And it's, as we were saying, the whole way of doing nuclear medicine has changed, and to my mind, very much for the better.
Yes, and I remember once also you mentioned about the importance of integration with surgeons and radiotherapists, oncologists, but also with radiochemists, because as you said, we really become quite important part in diagnostic and therapeutic management. So I think if basically any of the people that are on the other side, as you said, as our referrers, they should be probably invited to our conferences more to discuss different cases as well. So do you think about this multidisciplinary nature that we should?
I think that's actually important. In fact, when I was president for the conference we had, it came about in a funny way. Alan Perkins and I were asked to give a couple of talks at the Vets College in South Mims. And I got friendly with some of these vets, and they told me about veterinary nuclear medicine, which they were very interested in. Of course, that was what the whole thing was about. And so we got Greg Daniels from West Virginia to come over as the keynote speaker, and he gave a wonderful talk about veterinary nuclear medicine, which is again something which I was pleased to do, and we try to encourage the vets to come to the conferences as well, because they, dare I say it, have a different perspective on things, but all very interesting. I mean, to see how they have huge gamma cameras and huge PET scanners so that the animals can get inside them and not get stuck. And it was very interesting, and that was all actually jolly good fun. I'm sure Alan remembers it well too.
Yeah, I think that's really interesting talk. I think we might think about trying to reinvent that idea, for maybe one of the next meetings. Yeah, I think it's actually amazing area where nuclear medicine can really contribute as well, but also do a lot of research as well.
Oh, sure.
So, yeah. So if you have any final reflection or message that you'd like to share with the BNMS community as we mark this milestone, please.
Well, 60 years is a long time for any society. I mean, it's nothing compared with the College of Physicians and so on. But nevertheless, I think it's very significant because it shows a very positive, hands-on way of doing things, which needs to be encouraged. And my feeling, and I'm sure yours also, is we need to encourage the junior trainees, both in radiology and in medicine, to become involved, to learn more about nuclear medicine, to see how it works. I mean, you talked about the interreactions in therapy. I remember that when I was there, Adil used to do a lot of things like lutetium therapies, which the radiologist would put the catheters in place, and then he would deal with the therapy side. And things like that, where you are not sitting in a vacuum, as it were, that's the way forward.
Yeah, thank you. Absolutely. And also, I think they should submit work to nuclear medicine meetings.
Oh, very much so.
Yes, and to our nuclear medicine communication as well. And yeah, I can't wait to see you in Manchester.
Thank you.
Not long to go to our 60th anniversary celebration, and
yes.
See you for our BNMS meeting from 20th to 22nd of April, and to celebrate our achievement together.
Absolutely. And to finish on that, the mutual friend of ours, Marina, will also be there. So that will be a nice sort of meeting of minds.
Yes, I think, yeah, meetings are also for networking and meeting friends and building up friendships and collaborations. So thank you, John, again, and I'll see you soon.
Marvelous. And thank you for asking me.
Thank you.
Thank you. Bye-bye.
Bye-bye.